Welcome to Let's Get Curious, the podcast for women and mothers seeking connection, support, and inspiration. We are friends, mothers, and therapists. Lori, a physical therapist, and Dorothy, a speech and language therapist. Together, we share our personal stories, including IVF, birth experiences, and navigating children's learning difficulties. Through our discussions, we uncover profound lessons for personal growth. Join us on this journey of curiosity, compassion, and empowerment. Welcome to Let's Get Curious. Welcome back, everybody. Dorothy and I are so excited today to welcome back our dear friend and returning guest, Missy Broxton, for her third appearance on our podcast. If you've listened to episode 25, Making Sense of Learning Struggles, or episode 29, Why Crawling, Reflexes, and Sensory Development Matter, then you already know how passionate and insightful Missy is when it comes to child development and helping families connect the dots in ways that truly make sense. Missy Broxton is a pediatric occupational therapist with 28 years of experience and co-owner of Building Blocks Pediatric Therapies, a state-of-the-art outpatient sensory integration clinic in Santa Fe, New Mexico. She has extensive training in sensory integration, reflex integration, motor development, learning challenges, emotional regulation, and family support strategies. Over the years, she has become a trusted voice in the pediatric therapy and special needs community, known for her ability to take complex developmental concepts and make them understandable and practical for parents, educators, and clinicians alike. We always love our conversations with Missy because they are packed with insightful, real-life experience and those aha moments that leave you seeing child development in a completely different way. We're so happy to have her back with us again today. So, Missy, welcome back.
Thank you. Thank you.
As we said, we love having you back. We're still continuing. For those of you who follow us consistently, we are going to continue to talk about the pyramid of learning. And Missy's going to do a recap on that for anybody new. And we are going to dive deep, though, today on that one section of the pyramid on the sensory system.
Yes.
So, Missy, I'm going to let you take the lead, babe.
Just as a reminder, the learning pyramid was developed by an occupational therapist and a special educator. I never remember their names, but it is my Bible as a therapist, and I'm actually starting to bring it into my sessions in an evaluation for the parent to understand why we're doing a bottom-up approach. And just a reminder, the bottom-up approach is illustrated in the learning pyramid. The very bottom, the foundation, is all about our central nervous system and the pregnancy, the health during the pregnancy, and the delivery. And then the next layer up is all about sensory processing, which we're going to cover today. The next level up is the primitive reflexes. On top of the reflexes is more skilled coordinated movements. And then I believe above that, the top is the executive functioning, cognitive processing, focus and attention. So I have learned through my years of experiences, we can address the top things, but we're not changing their functioning. We're just giving them a splinter skill. So if we start at the bottom and work our way up and address things as we go, we're solidifying the foundational skills so that as developmental milestones happen and cognitive focusing and all that happens, the child is able to adapt and learn.
Yes. So just to do a quick little recap then, Missy, when you're talking about that top of the pyramid and just giving splinter skills, that's for those possible referrals that the schools might be picking up, right? Such as like your kid is having trouble with handwriting or scissors. And so you could go in and try to correct their positioning with their fingers on a pencil. But if you're not fixing the lower part of that pyramid that we're talking about, those primitive reflexes, issues with sensory, then you're just touching the surface, right?
You're just touching the surface. And it's important for your listeners to know that as an occupational therapist, we can work in a diverse places, from inpatient psych to working for a big corporation doing ergonomics. So when in our schooling, we get a little bit of everything. And having the knowledge of sensory processing, primitive reflexes, I had to do that all on my own outside of education. It was because it's my passion. So if you're working with a therapist as a parent, you have the right to say, are you trained in sensory processing? Have you taken courses? Things like that.
Yes, because not all OTs are the same.
No.
Right. Just like all
And
speech
some
therapists
OTs might say, I don't know what you're talking about, to be honest.
Right.
I've gotten that as a parent.
Mm-hmm.
I've
And
never
I'll
heard
say
of primitive
if I don't
reflexes.
know something, I'm not going to bullshit. I'll be like, you know what? I don't know.
Mm-hmm.
And let me get back to you. Or I haven't addressed that in a while. Let me go get some current information and get back to you.
Mm-hmm.
Yeah.
Anyways.
Wonderful. No, it's
that was
always
a little bit of a deter because I have a student starting tomorrow at my work. So.
Well, it's important information though, because we tend to get in this way of thinking of that we're all like physical therapists are all the same. Speech therapists are all right. The doctors are all, no, everybody has their own specialty. And with occupational therapy, there is that broadness to it. From a corporation to your own personal clinic, like you work in with your own niche. So yes, asking those questions specifically are very, very important.
They are. So let's dive into sensory processing.
Let's do it.
So I'm going to first talk about when it works. Well, what it is and when it works and what it looks like. So sensory processing is our brain and body's ability to take in information, organize it in our brain, and respond appropriately. And appropriate could be a motor response, an emotional response, or a behavioral output. When the system works, we're efficient, we're adaptive, and we're regulated. When it doesn't work, we're over-responsive, under-responsive, poor modulation, disorganized movement, and emotional output. And what I'm going to do is when I go through each of the 8 senses, we're going to talk about what's over and what's under.
Oh, amazing.
So, and then what works. So I like to think of a computer. So like the input would be me typing on the computer. And so I'm giving it the input. It receives the input and it organizes it in its computer brain. And then if I did it right, it responds appropriately with my document or the printout. The thing with sensory processing, it can break. We're not really quite sure where it breaks down. You know, is the input coming in too soft or too aggressive? Is the way it organizes and transfers in the sensory motor strip, is that where the issue is? Or does it break down coming out for the adaptive response? We're not quite sure. So when it works, we can maintain being alert but calm. We're not alert and hyper, we're alert and calm. And we can make shifts in our arousal from a quiet state to an active state. We can make those shifts easy without effort. Second thing we can do is filter out sensory input. There's days that I really struggle on this one. There's days that I can block out all the noise around me and focus. And then there's days that every little blip of noise around me is catching my attention. So then I go clean and organize something because I'm not going to get anything done. So filter out sensory input, attends to the relative stimuli that's around you, and we ignore background distractions. After we do that, we can demonstrate appropriate adaptive responses. So our response fits the situation. It's what others would expect of us. If we're in a conversation or playing, that we're shifting from calm and alert, we're playing together, we're compromising all those good things. We're not overreactive or underreactive. So then it looks at our movement. We're coordinated. We have efficient motor planning. And motor planning is the ability, like if I see a truck, in my brain, I know it's a truck. I have all these ideas I can do with that truck. So that's called ideation. And then my brain then has to come out with a motor output of, I can take that truck, put it on the track, and let it go down the ramp successfully. Our movement would be balanced. We have a balanced posture and coordination of both sides of the body. I think this is a big one that we see most of our kids struggling in, but we're talking about the positive, is the regulation of emotions and behavior, so that they're able to have flexible transitions. They're able to maintain that frustration level appropriately. And then lastly, it's all about engaging in daily occupation. So we can play, we can learn, we can socially participate when everything's working correctly.
Mm-hmm.
Okay?
Yes.
So let's talk about the sensory differences. Just a random thought. The out of sync child is the hallmark book for parents. It's by Carol Kranowitz. I think she's on her 3rd edition. That is like the Bible. It doesn't have the jargon. It talks about here's what a typical response looks like for every system, and here's an atypical, and there's a nice comparison. Okay, so with sensory processing, there's 3 types of categories underneath the umbrella of sensory processing. There's sensory modulation, sensory discrimination, and sensory-based motor challenges. Sensory modulation is all about if you're over-responsive, under-responsive, sensory seeking. So it's that foundation of what's my regulation like? And then sensory discrimination is difficulty interpreting sensory input. So like if I feel a blanket and I say, oh, it's soft, and another kid feels the blanket and they're like, that is scratchy. So one of us, our discrimination of, is it soft, hard, wet, dry, all the descriptive things is about sensory discrimination. And then the sensory motor based challenges are about poor postural strength and dyspraxia. So dyspraxia is motor planning difficulty. They have an idea, but they literally have no idea how to coordinate their brain and body to get it done. And so those are the 3 categories.
So I have a question, Missy, back to sensory discrimination. So you gave the
Yeah.
example of the blanket. One person thinks it's smooth and soft, and then the other person thinks it's scratchy. So are you saying that they're having trouble interpreting the correct sensation?
Yeah.
So, okay. So would that just
I
so
think of clothing too.
I was just going to say that. Yeah. Yeah.
You know, the underwear and sock seams.
So is that like too much sensory input? Like, are they feeling it too much?
Well, that would be the over responsiveness. Yep.
Got
the
it.
hypersensitive. So if the tags are bothering you, or typically when we put clothes on, our body should adapt usually within 3 minutes, meaning I don't feel my clothes anymore.
Mm-hmm.
You know, but there's kids that they feel that tag, they feel something there, and they can't put it in the background and forget about it because it's constantly getting their attention.
Mm-hmm. I can imagine how that child is struggling in the school then when they've got a tag or socks that are uncomfortable and they're asked to sit at their desk and pay attention, and all they're thinking about is, damn, this tag feels awful. I just want to take off my socks.
My son in middle school, he went to a charter school in Hartford, and they had to wear a uniform with a belt, and he could not sit in a chair with a desk regular. First of all, he kept feeling the hem, not the hem, but the top of his pants and the belt and the tightness. And then he had an active spinal galant, which we talked about, where the back of your back is touched, and you like whoop, and you have these movements that you can't control. So between the tactile sensory input and his spinal galant, he would always want to turn so he'd sit sideways in the chair or backwards. Oh, that boy got in trouble so much. But at that point, I didn't know about primitive reflexes.
Sure. Well, and I'm sure most teachers still don't know about any of this stuff. Yeah.
No.
That's when the sticker charts come out.
Yes.
If you sit properly and ignore that awful feeling, you get a star.
Yeah. Mm-hmm.
Like that's
So
going to
true.
work.
Yes. Mm-hmm.
Yeah.
And then they can't pay
That's
attention.
another topic.
Right? That's a whole nother topic.
Whole other day. Yeah.
Right. But then they can't pay
attention, and they're more focused on trying not to respond to the input instead of paying attention to learning.
Exactly.
Oh,
Yep.
yeah.
Mm-hmm. I could go on forever.
And we love you for that. That's why you're here.
Some people do. Some people think I'm too much. It's totally fine. No. Okay, so now we're going to talk about the 8 sensory systems.
Okay, great. So the first one we're going to talk about is touch, the tactile system. So the purpose of that job is to detect touch, pressure, temperature, and pain. So when your system is calm and not hyper or hypo, which I'll talk about in a minute, if someone touches you or walks by you and you're like, oh, you just touched me, total response, you might turn and look, a perfect amount of pressure, and then they can manage if they're hot or cold or feel it, and then appropriately respond to pain. It also supports our body awareness and our emotional security with touch. Because touch needs to be safe, right?
Yeah.
So when it's working well, we can tolerate different textures. We can use touch to explore safely, especially like going into a store that has a lot of trinkets. We can just touch lightly or not touch at all. And then grooming and clothing is easy peasy. So the challenge when it's over responsive, so when kids can't interpret touch appropriately, touch becomes too much, they avoid textures, and then they become distressed with touch. So I have, depending on my arousal level, an over responsiveness to touch. I can't stand light touch. To me, light touch is like walking into a cobweb. You can't see it, but you feel it and you can't get rid of it. If someone touches me light, I just rub it.
Yeah.
And parents are like, oh no, they have no problem with touch. So if I'm in the first session with them, I'll nonchalantly touch their knee, or as I go by, touch their hand by accident, and I look for their response. Do they just look at me and like, oh, that was weird? Do they not even notice? Or they're like, hey, we all know those children.
So can that change, Missy? Can that change? Can sometimes a child be under responsive and sometimes over responsive? Okay, so
absolutely. And that's why sensory is so challenging.
Yeah.
Is because it all depends on your arousal level, your threshold that day, like how much can you handle and regroup, is tricky. It's intense. Yeah. So they could be good in the morning, and by right before lunch, they could be like, I can't take another thing. So I'm a very visual person. And this to me was a game changer when I learned this in a course. So let's see. Okay. This space here between these two lines is called your optimal band of arousal. Okay. This is our threshold to get through the day.
Okay, so Missy, I'm going to just pause you a quick second. It's just for our listeners. So Missy's holding up a white piece of paper right now, and she has 2 lines drawn on it horizontally with an H on the top and an L on the bottom. And between those 2 lines is what you're describing as our sensory threshold.
Right. And this picture, the lines are about 2 inches apart. So this is a representation of someone who doesn't have sensory challenges. Okay. So the top line, the H, is high arousal. It's fight or flight. It's the point of no return. So this is hyper responsive. The L is low. So this is hypo responsive. So on the top is hyper responsive. Our responses are too much. And on the bottom is low, we're withdrawn. We're not really registering what's going on. So I'm going to draw like a mountain ridge of ups and downs from left to right. So we get up in the morning and we start down at the low arousal. And then we get up, we get our kids going. It's the morning routine, get dressed, brush your teeth, eat your breakfast, get ready for school. And then you hit like your stress. So you're about halfway between your low and high arousal. Then you drop the kids off, the doors close, and you take a breath and you regroup. So now you have the down slope. Then you get to work and you're stressed and you have this upslope. So people who don't have sensory processing challenges, they do this up and down all day long. They have strategies. They have a higher threshold to input.
Got it. And they're always staying within those two lines.
Always
Right.
staying. Yep. There's a nice balance. And then
Got
at
it.
the end, all the way to the right of the line is like a slow, even decline. You just get ready for bed and you lull to sleep.
Mm-hmm.
Now, think of the same picture in your brain, but make the lines maybe a half an inch apart. And then you still have your high arousal and you still have your low arousal. But since your threshold is very minimal, your lines are closer together. So this is sensory processing. This is stress. This is all of it. So you have the same thing, high arousal and low arousal. And then as you get stressed throughout the day, you don't have the ability to regroup. You kind of get stressed. You go up maybe a centimeter, and then that's your new level. And all day you go up a little bit and level out. You go up a little bit and level out until you get home from school and you walk in the door and shit hits the fan, right? Mm-hmm. So when the kid gets to that high arousal mark and go over, I call that the point of no return. It's that meltdown that you can't stop. You just have to make sure they're safe. And you can't rationalize with them at this point. You just got to let them ride it out. So the tricky part is when they finally stop their tantrum and you co-regulate with them, there's two things that happen. One, those kids are out. They sleep. Or they're right under that high arousal line and you're just waiting for the next shoe to drop. But when these kids finally go to bed, they're out. Yeah. They are out. Nothing's going to wake them up. Often that's why some of these kiddos are late bedwetters, is because their brain and body held it together so hard and so long at school, and then had a release that no message is getting to their brain to wake up alert. You know, I always talk to parents. They're like, I need to like shake my child for them to finally awake. Wow. So when I talk about threshold, that's what I mean.
Mm-hmm. That's really helpful.
And that threshold varies depending on the day. How did they sleep? How was their getting up and getting out of the house? How was that first period teacher? How were the hallways? So much.
Yeah, makes sense.
Does that make sense?
Mm-hmm.
Okay.
Absolutely.
We just finished tactile. Any questions before we go into the next one? No,
we're good.
Makes sense.
Okay, so the next one I have is vestibular. So your vestibular sense is your movement and balance sense. So every time your head moves, we have these semicircular canals in our middle ear. There's 3 canals with hair cells and water in it. And every time our head turns, it tells our body that we're moving. It tells you if you're upright, if you're upside down. So it's detecting our head movement and gravity. Our vestibular system controls balance and spatial orientation. Okay. When it works well, we have balance, we move confidently, and we coordinate our head and eye movements. So our vision sense and our vestibular sense are closely linked. When we're over responsive, when a child's sitting on a swing and they're just sitting there, all good intentions, you go up and push them. Woo! Like they are so fearful of the movement. These kiddos, I hang the swing up, but the swing is literally on the ground. And we increment it itty bitty just to get them more confident and less fearful of movement. And then if they're under responsive, we all have kiddos in our mind. Those kids can spin, and they don't get dizzy. They are seekers. They are crashers. And as a therapist, I'm always worried about those under responsive kids. I really work intensely with them on getting them to orient to movement,
and get their brain and body to be like, okay, you're spinning. I had a kiddo when I was back in Connecticut. I worked with her for a year and a half on intense vestibular input. And the mom called me after a year and a half on the way home, and the poor kid vomited in the car. And she's like, I think she's sick. I'm like, no, I think her vestibular finally registered. I'm really sorry she vomited. It's really good news. So then we had to learn, how do we balance that? Because she's used to sinking, but now it's too much for her system because now her body is aware of movement. So the big thing about over responsiveness is car sickness. You put a kiddo in a car, no matter where they sit, they are car sick. One of the way the body, the brain adapts is that they make the kid fall asleep. It's neurological overload, and they sleep.
Wow. So how do you fix that, Missy? If you have a kid that's car sick, like what would be activities that somebody would do?
So I work on simple movement, like one direction,
front to back. And then I do a program called the astronaut program. So often when you have motion sickness,
what your eyes are seeing versus what your vestibular system is registering are a mismatch. So that's why you get car sick. And I do an astronaut program. So we start with, we call them twirlies, and they stand in position. And our goal, so your hands are out to the side of you with your palms
up towards the ceiling. The goal is to get 10 rotations. So you go clockwise 10 times, stop.
And you should not be dizzy after 5 seconds. So when I first started working on my vestibular system, I'd spin 10, could just make it, and I was dizzy for like 18 seconds.
Wow. So then you just keep doing that? Like I keep
doing it.
Practicing.
When I first started, I could only do 3 spins.
Yeah, that would be me right now.
Yeah.
My son puts me on he loves the spinner. Talk about like sensory seeker. So he loves the spinner on the merry-go-round. Loves it. I can handle it maybe, I don't know, 6, 7 spins and then forget it. Like I am coming off that thing. Good. I'm nauseous. I'm still dizzy. I'm holding on to things so I don't like fall back onto the spinning thing. Like I'm a mess.
Yeah. So this system also, as we age, isn't so efficient anymore.
I'm noticing.
After I had my kids, it wasn't efficient anymore. So I had to start working on it again. One quick note, my son is a basic EMT, and he learned that when you go in an ambulance and you're nauseous, they'll have you smell an alcohol wipe or hand sanitizer before they'll give you medicine.
Wow.
So I use it on a plane. Like my ride home from the East Coast, from Denver to Santa Fe the other day was so bad. I'm like, squeezing the sanitizer. My window shade was stuck down. So I normally will like look at something stable. So I'll look at the ground and try to balance out that,
okay, I'm looking at something stable, but my body's moving to try to regulate it. I couldn't do that.
Wow.
It was not good.
Yeah, the lady next to me was like, I'm like, this is an EMT trick, I promise. Oh, it's so great. So vestibular, also, just a side note, if you're working with kids who are sensitive, like, don't think it's funny to spin them in an office chair or spin them on the playground. Vestibular input is so intense that if it really will impact you the rest of the day. Mm-hmm. Like after that flight, I had to come home and sleep 3 hours, and then I wasn't sick anymore.
Wow.
So vestibular is very intense. Okay. System 3, proprioceptive system. So that's our body awareness. We get messages from our ligaments and our joints. When we move them, it goes up to our brain, to our sensory strip, and says, oh, your wrist is moving. Oh, your foot is moving. It's connecting our body to our brain. So it gives us a sense of our positioning and our joint positioning without using vision. Mm-hmm. And then it also provides feedback for force, how much force we're exuding, and movement. So when it's working great, we're using appropriate force, we move efficiently, and we feel grounded and organized. So we all have those kids. You say, hey, come give me a hug, and they're plow you over. Yeah. That's a classic sign of they don't have enough sense of where their body is in space. So they have a hard time modulating that force. They're always too hard or too soft. I had a kiddo the other day. We were looking at pictures for zones of regulation, and I said, just tap the pad, the touchpad. And he wasn't touching it hard enough. And I'm like, I haven't seen difficulty to put more force in. Usually is the classic, the kiddos are using such excessive force. But I was like, no, push. And so then I was like, giving them input. So I'm like, this is your arm, this is your hand. Now push.
Did it work?
It worked.
Oh, good.
I'm glad you said that. Did it work? Any input that you do, like a sensory diet, mm-hmm. It releases serotonin, which is that happy hormone in our brain or chemical in our brain. And it stays at that level for a short amount of time. So some kids it's 60 minutes, some kids it's 90 minutes. It doesn't stay at that level all day long. So that's why they have sensory diets. They say once the therapist understands your child's system, they can say, you need to do something every hour. You need to do something every 2 hours to fill their sensory bucket again so that they can at that higher executive functioning piece on the learning pyramid. And then the challenges if they're seeking is it's those kids that are constantly moving. It's those kids that heavy work. They're always looking to crash and move their body and slam and purposely fall to try to fill that system up. Things that are really good to help the proprioceptive input are things you do with your whole body. Pushing something, carrying something, pulling, putty, carrying things, climbing, anything you can do. Chewing even helps with organization. So for snacks, I always tell parents if they have a sensory kiddo, crunchy, a hard resistance like carrots, those hard pretzel rods type of thing are really good to help keep them organized and keep their proprioceptive system functioning.
So if someone eats a carrot or a hard, crunchy pretzel, does that only organize the mouth, or does it transfer and organize the whole body?
It's pretty much just the mouth, but your TMJ is close to your visual vestibular system. So it can help with arousal. Like I know when I was in school, in college, I ate like a fiend. I was in school all day, Saturday, all day, Sunday. And I ate to keep my arousal.
Yeah, makes sense.
Yeah. Okay. Can we talk about the visual system?
Yes, please.
This is also a soapbox topic for me. So our visual system is our eyes and what we see. So we process light, color, movement, and spatial relations. So how close something is, how far something is. There are those kiddos that like overreach past the object or underreach and they have to adjust, are some of the challenges. When it works well, we track smoothly. So when we talk about vision, it's not just your 20/20, do you need glasses and the health of your eyes? It's about function. For me as an OT, it's about function. It's how your brain is organizing your two eyes together. So tracking is the ability to, you keep your head still and you follow a moving object in front of you, left to right, top to bottom, diagonal, circles. By the age of 5 and 6, the child should be able to sit, keep their whole body stabilized, and just move their eyes, following a target. It's also essential for maintaining visual attention, being able to stare at something. So many kids that I work with, they look and they look away. They look at you and they look away. And it's because they can't sustain that visual attention. And then coordinating your eyes with your hands. Not only I pick up the pencil, my pencil's going towards the paper and I now form words or letters or shapes. It's that whole process of depth perception, location of an object in relation to your reach. So challenges are that difficulty of following and separating your eye and head movements. That challenge is if a child has to look to the whiteboard, back down to their desk, it's not a smooth transition. They have a hard time looking at the board and then looking at their paper where they're supposed to be on the paper, and then look back up at the board and they lose where they're supposed to look. So every time they have to make that visual transition, there's processing time that they lose until it's clear, and then their vision's clear, they know where to go, and then they just missed maybe 10 seconds of language of what the teacher's trying to teach. Mm-hmm. You also become visually overwhelmed. So the best example, I was walking into Costco and I'm going down the aisles and I just felt so overwhelmed. So I stood still. My mom's like, "What's wrong with you?" I'm like, "We got to go because I can't do this right now." For whatever reason, in that moment, my vision was curving all the shelves. So when I go down the aisle, it was the craziest thing. That has only ever happened to me once.
But then I think of our kids who don't have language to express that. And here's the thing.
When you have functional vision challenges, that's the way you've seen your whole life. You think it's normal. You know, I learned about functional vision 15 years ago. So I think about all those kids I treated the other 15 years prior
and how I just missed it. I didn't know. So that is like hallmark for me.
Oh, one other thing you might see with a child with visual issues is they put their head down when they're writing. So they go like this and write. They're actually turning off. So if I'm right-handed and I put my head down like this, I'm turning off my left eye if I'm like super close to the paper. My nose blocks it. So then I'm really only using one eye, which then makes it hard to form letters and stay on the writing line and things like that. Any questions with vision?
No, I just think about all the kids that are struggling to learn how to read, and parents are like hitting their head against the wall going, "What do we do? How do we fix this?" They're 8, 9, 10 years old, and they're still struggling. And I just hope that they hear this and know to seek out help.
So Dorothy and I went to elementary, middle, and high school together. In elementary school and middle school, we were in a Catholic school. And gosh, that was back in 80s, right?
Yep.
Yeah, 80s.
Yep.
And I had all the tutoring for reading. I had all the dyslexia strategies. None of them worked. Because my issue wasn't dyslexia. My issue was functional vision. So for the listeners, if you have a concern, and I have glasses, people who have 20/20 vision have functional vision issues, there's a website called covd.org, and it's all about functional vision. And you can find a provider that addresses functional vision. And it gives you like a checklist of how it impacts learning and what are you seeing with your child. It's wonderful.
Love that.
Yes, and to just go off of you a little bit, Dee Dee, really quick. Again, if your kid's being referred out to a reading specialist at school, I think it's an immediate red flag. Let's go get the eyes checked, the vision.
Right. And not just a regular eye doctor.
No.
It's a developmental optometrist or behavioral optometrist that addresses this.
Exactly. We actually did a podcast with my daughter's doctor, who's a developmental optometrist. And we broke all of it down and what the differences are and what to look for. And
perfect.
No, it's super important. It's super important. So, yes.
Okay. Next system, auditory system. So the job of the auditory system is to process sound, tone, rhythm, and language. When it works well, we can follow directions, we can filter out background noise, and we can engage in conversations. When it's not, we're oversensitive to noise. When my threshold is up by the high arousal, I'm a grown woman at 50, and if you're sitting next to me, if you're sitting at my table and I know you well, and you're like putting your silverware together, or like you're cutting food so hard that your knife is squeaking, I will grab your arm. And I can't control it. I literally can't control it. My father-in-law is 86 years old, and we're out to dinner. He gives me his plate to cut up his food, because not only does he squeak the knife on the plate, he goes,
even when there's no food on the fork. And I would get mad. And then if you bite
the fork?
Yes.
I can't. And I'm grown. I know better. But to me, it is like a personal assault on my body.
Same.
Yeah. You want to know what drives me crazy is hearing the seeds of a strawberry being chewed. How bizarre is that? Yes. When Al eats strawberries, I can hear it like across the room, and I'm right there with you, Missy. I'm like, oh my God.
I've never heard that one.
Yeah. I don't know what it is. But there's just all those like tiny little like pop. And I mean, granted, when I chew the strawberries, I hear it myself. For me too.
Yeah.
It doesn't bother me. When I hear it coming from somebody else, it drives me nuts.
Oh my
gosh. So it drives you nuts when someone else does it because you're not in control.
Yeah.
And that's why our kids that have sensory challenges,
great point.
They are the best manipulators of their environment and the people around them, so they have control. It's bananas how like an infant can do it to us.
Wow.
Yeah, it's pretty cool.
Yeah.
And then another challenge is difficulty processing verbal information, and then appears not to listen. Like they're just blocking you out. I always tell parents, go touch your child on the arm, get their attention, and then talk to them. Because you'll say it 2-3 times in a normal voice, and then you yell, and then they answer. And you're like, why do I always have to yell? I'm like, go touch them, get their attention, and then talk to them, because then they'll be able to hear you. They're oriented to you and not into what they're doing, their tablet or whatever.
And it's so easy as a parent to feel like your kid is just being defiant and ignoring you when it could be something totally different. Good tip.
And then our threshold comes into play too.
Oh yeah.
You know, co-regulation is so important. I could do it with other people's children. If you were to talk to my children who are now 21 and almost 26, I wasn't so patient with them. I could sit with a child who didn't have a tantrum for an hour and a half and just sit there and be neutral.
Wow.
My children, maybe it was a minute or two, because I spent my energy and my threshold at work. I didn't have it when I got home. So that's important too, to realize if you have another adult in your environment and someone who is on this sensory journey with you, I got to tap out. Yeah, because we do it at work and support each other all the time, because we have to be regulated to help other kids regulate.
Mm-hmm. So true.
Yes. Let's talk about a gustatory taste system. This is another issue of mine. But when it works, we can detect taste, sweet, sour, salty, bitter. We tolerate a range of food. We tolerate textures and flavors appropriately. And I think this is one of the hallmarks of sensory processing, is the picky eater. Mm-hmm. I'm a picky eater. I've always been a picky eater. People will say, well, you're a sensory OT. Don't you know how to fix it? I'm fine being a picky eater. I don't need to explore that. I get my nutrition. But yeah, extreme picky eating, limited diet, and sensory aversions. So here's another one of my soapbox issues. There's a program called SOS Feeding Approach. OTs, speech, have this training and certification if they choose to. It's more about you play with food versus an ABA approach. You got to touch that 5 times. Touch it, touch it, touch it. You get a token. I strongly recommend, professionally, don't take a behavioral approach to this, because your kid's just going to resist more and restrict more. In the SOS training, we learn, I want to say there's like 28 steps, from you being in a room with a food all the way to you chewing and swallowing that food. So we start at the bottom. We start at, how close can we get the food to the child? We have learning plates. So if we're having a snack, okay, here's your snack plate, but then we have a learning plate. I know you don't want the mashed potatoes, but we're just going to keep them on this learning plate. And then we have a spit cup. So if they're willing to take that chance to touch it, bring it close to their mouth, touch your nose until they finally lick it, they might gag. Okay, well, spit whatever you have in your mouth, just spit in the cup. I don't do food therapy, picky eating, because I have my own issues. So I farm that out to the other therapists in our office. But it's all about that hallmark of safety. They feel safe around the food. We play with food. We paint with food. We let the kids make a mess and make a concoction, because they're engaging with it. They're seeing it. They're feeling it. They're smelling it. And they're in control. So it's probably one of the slowest sensory system to get gains in, because it's all about that, all about having to break down their cognitive walls that they have up about food. But the minute you push them too far, you're like 2-3 steps back again.
I'm on the SOS Feeding website, sosapproachtofeeding.com.
Yes.
Yeah. And they do have a find a professional section.
Perfect. That's what I strongly recommend. And then we have 2 more sensory systems. One is olfactory, so the smell. We detect odor. It's strongly linked to our memories and our emotional responses. So you can see where taste and smell go together, because it could be a positive memory, but it also could be a not so positive memory. So when it works well, we can tolerate everyday smells. We can use smells appropriately, and we can respond appropriately. But then when there's challenge, we have strong reactions to smell. If I'm sitting next to someone that has fish, I tend to move a seat over, depending on my arousal. Usually it's at dinner time. My father-in-law, I'm like, I'm not sitting next to you. Just because I get to a point where I can't appropriately respond anymore. I can't have an adaptive response.
So, Missy, could I ask you a question? So, in this podcast, we've said a lot about your father-in-law, but that's not the question. We said we've said a lot about depending on my level of arousal. So, does that mean then if someone is sensitive to something and then they go in and implement their sensory diet to help with their level of arousal to get more regulated, could they then go back and be less reactive or less sensitive to that same stimuli?
It'll be more, I don't want to say if it's less reactive or more reactive, they'll be more available for the learning and the experience.
Got it. Okay.
One of the things under responsive is those kids that smell everything. Everything goes through their nose first. And the smell, because it's so linked to our memories and emotions, you get like a dopamine dump. If you like it, you're alert, you're engaging. If you don't like it, you are withdrawn. Side note, if you can't get a smell out of your nose, smell ground coffee.
Oh, cool.
Clears the palate.
Fascinating.
That is so cool.
And our last sensory system, and this is the longest to start functioning appropriately, is our interoception. It's knowing what's happening and sensing what's happening inside our bodies. So hunger, thirst, am I hot, am I cold? Emotions, them actually understanding their emotions and being able to identify it. And then bathroom, potty training. So if it's working well, kids can recognize their body signals. If they're sick, if they have a pain, they can label their emotions well. And then they're regulated and their physical needs can be met. So then you get the challenges of they don't notice they're hungry. So then you get hangry, or they have a hard time with potty training. They're not able to identify their emotions appropriately so that they recognize it, that I'm mad, and then what I can do. And then they just have really poor self-regulation. They're often dysregulated, which is, I would say, everyone I see in my practice.
Well, it makes sense, right? It makes sense because if you're having this feeling in your body, even though you can't describe it and it doesn't feel good, you're going to get annoyed by it and be dysregulated. Yeah.
And I'll have 6, 7, 8-year-old clients that will say happy, mad, and sad. That's the only emotions they know. And I'm like, we need to expand that. There's an amazing program, Kelly Maher, Maher. She's like interoception queen.
Okay. I've taken a few of her courses. She's wonderful.
Yeah.
Wonderful.
So those are our 8 systems, not just 5 sensory systems. And the things that I just want to have like takeaways is that sensory processing is foundation to all of our functioning. So if you're not regulated and you're not addressing appropriately responding to sensory input, there's no way you're going to function at your potential at the sections above in the learning pyramid. And then this is also difficult for parents to switch their thinking. Behavior is often sensory driven. So if a kiddo starts having a behavior with me in the office, I don't respond right away. I take a minute. I look to see what is the behavior they're doing. What did we just do? How can I help get them more regulated again? So it's not them being full or spiteful most of the time. I always tell parents, you have to respond with a sensory strategy. And I always go back to that proprioceptive first. Do the heavy work. Do the bear hugs, body hugs, squeezes, because that's your most foundational skill that helps connect your brain and body again so they can regulate. And then regulation, as I said before, has to come first before skill building. If you have that kid wiggling in that chair in class or falling off the chair or getting up, getting down, they are paying attention to everything but what the teacher's saying. And for teachers to realize, take a minute. They're not ignoring you. They're not misbehaving. What is happening? What do they look like when they're sitting in their chair? Can they sit on something else? Can they stand in the back and learn? There's a lot of things that can happen before they're sent to the principal's office. And then just be mindful. And this is what I love about my job. Everything I do is play-based. I play all day. And that play has to be meaningful for that child so that they engage. And then there's always a sensory component to what I'm doing. If I'm working on handwriting, for sure, we're going to start in the gym and do gross motor work. We're going to do ball pit. We're going to do jumping and crashing. We're going to do the zip line. We're going to hang on the monkey bars, all to connect the brain and body together. And then we'll do animal walks to the table. We'll do frog jumps. We'll do bear walks. We'll do whatever the kid can think of. And then if I'm working on handwriting, sometimes I'll put a light grade sandpaper under it. Or maybe we're going to make letters in Theraputty with a popsicle stick. Or maybe we'll just shape letters with a popsicle stick or Play-Doh. Something that has more enriched input to connect their brain body to the learning process, to reinforce that learning.
You were just a wealth of information. I'm just like, did I just scare you? Sorry.
I'm done.
Are you awake? It's just, you just blow me away. Like, as a homeschooling mom with a child who has writing challenges, I can just tell you, I have learned so much in the last 2 minutes of what I can do to help him with his writing. I'm just so thankful that you came and chatted with us today. You're just,
I appreciate you guys asking, because you know what? So I actually just reached out to the New Mexico Occupational Therapy Board or Association to see what it takes to put a course together for providers. So I've been saying I'm going to do it. I'm going to do it. You guys let me practice. I can still be my quirky self, and I can teach providers.
Love it.
Love it. And we need it.
Mm-hmm. Yeah. Can we put teachers on the list?
Oh, yeah.
Yeah.
Yes.
Oh, absolutely.
Right. I know.
That's and then after that, a parent course.
Yes.
Listen, Missy, we have ideas for you.
Yes, ma'am.
Don't you worry. Dorothy and I will keep you busy.
Busy is never a problem.
And one thing I want to add to our list of resources, another great book that both Dorothy and I read was Big Baffling Behaviors by Robin Goebel. It's a super easy read, but it does get into the nervous system of being, you're either in fight, flight, or freeze, but she really breaks these down into dog attack mode versus are you in possum mode? And she talks about the sensory in there. So it's just a very good, easy read for parents that just breaks it all down and makes things relatable. And she gives real life situations, like cases that she is working on in her office. So yeah, that will be in the show notes as well. Everybody, thank you for tuning in, listening once again, being curious with us. Again, everything will be in the show notes. And as always, let's stay curious and we will see you the next time. Bye, everybody.
Bye-bye.
The information shared on this podcast is for informational purposes only and is based on the opinions and experience of Lori, Dorothy, and their guests. The content should not be used as a substitute for professional medical advice, diagnosis, or a treatment. Always seek the advice of your healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast.